Hello, my name is Mr. Ojutiku. I'm a consultant gynaecologist practicing in London, Brentwood and Chelmsford. Today I would like to talk about Polycystic Ovary Syndrome, sometimes referred to as PCOS. Essentially, it's important to understand the origins of it, or the cause of it. It's a hormone imbalance which results in poor ovulation. It can affect the skin, and it can also affect your chances of having a baby. I'm not very keen on the term polycystic ovary syndrome because it makes one focus on the ovaries as the cause of the problem, when in actual fact the problem is within the hemostatic mechanisms in the body and the brain, which control the ovaries. And the ovaries are, with polycystic appearances, are effectively a reflection of the hormone imbalance. They are not the cause of the hormone imbalance. And just as I mentioned, it often starts during puberty, and it causes what we call irregularity in your periods, difficulty with complexion, unwanted hair growth, and difficulty in losing weight, and it progresses as one gets older. It is a condition which is not treated with, it's diagnosed, with a number of things, including ultrasound scans, your clinical presentation and blood test. It is not, and I emphasize, it is not based on ultrasound scan. So having an ultrasound scan which shows polycystic ovary morphology does not make a diagnosis of polycystic ovary syndrome. And this is a situation which I tend to see quite a lot, where a scan has picked up ovaries which look polycystic, i.e. polycystic ovary morphology, and as a result of that, people are often informed in the community that they may have polycystic ovary syndrome, or they have polycystic ovary syndrome. Now, the diagnosis is a little bit more nuanced than that, and it's about putting bits of information together in order to achieve a diagnosis, one which obviously gynecologists understand, but it's not always fully understood in the community or by non-gynecologists. But once you're seen, it's a condition which, once a diagnosis has been made, it's managed as opposed to treated with surgery or medication. I must emphasize also the fact that out of all the symptoms that I mentioned, you might notice I didn't mention pain or heavy bleeding. Ovarian dysfunction essentially means that the periods become irregular and infrequent, so they get more spaced out. And therein lies the explanation about problems with or delayed conception or having babies. I prefer that term as opposed to infertility or failure to have babies, because one can have babies with polycystic ovary syndrome, but if you look at it critically, essentially, if every woman ovulates 12 times a year, and you have polycystic ovaries and you ovulate 6 times a year, i.e. 6 periods a year, that essentially means that it takes you twice as long to get pregnant. But it doesn't mean one cannot get pregnant. Okay. The treatment is essentially aimed at addressing the individual causes, because it's a lifelong condition and you don't have it and then it goes away. So if you have a scan that suggests the ovaries look normal, it doesn't mean that the condition has resolved. It just means that you're going through a phase where the ovaries do not look polycystic, but the condition is still present. Okay, the treatment for the condition involves treating whether it's problems with complexion, problems with periods, problems with weight, and you address those individually, and essentially it's more or less lifelong for those conditions. The symptoms can resolve once the periods stop. One of the mainstays of treatment, however, is helping losing weight. And because losing weight can be more difficult if you have polycystic ovary syndrome, but helping to lose weight can actually help more regular ovulation, and of course that will enhance having babies. And in addition to that, the other effects on the skin, which might take a bit longer to settle, but they tend to settle too.